When you decide to sign up for Medicare, it is the single biggest health insurance decision you'll make in your life, and it's almost permanent as well. I'm going to help equip you to make a great decision when it's your time. That and more coming up. My name is Mike Bernard. I'm the host of the Wise Money Show. I'm also one of the certified financial planners right here at Korhorn Financial Group. Make sure you hit that subscribe button, turn on notifications, and smash that thumbs up button. It's Medicare Open Enrollment, and that goes from October 15 to December 7th. Every single fall, you've got the opportunity to make a couple changes if you're already on Medicare. We're going to talk about that, but I want to zoom out. I mean, when you get on Medicare, it is the single biggest health insurance decision you're going to make in your life, and it's just about permanent. Other than this open enrollment time period or if something else significant changes, there's not a lot of changes you can make once you make this key decision. I'm going to help you really just identify what that decision is and sort of lay the groundwork, provide you the groundwork, information, education that you need in order to make a great decision. So, what is that decision? By the time you turn 65 or you stop working and are eligible for Medicare, okay, so there's a couple different eligibility requirements there, but for most people it's age 65, you then have a choice. You have a choice. Once you're eligible for Medicare, you have a choice. You can go with what I call traditional Medicare, or you can go with Medicare Advantage. So traditional Medicare or Medicare Advantage. One of the problems with this is they're both, even though that's one big fork in the road, they're both called Medicare. So this is the thing, at a time in your life where you're going to make the biggest decision and you want the decision to be clear, you want stuff to be simple, you want it to be understandable, it is not, it is confusing. We use the same name, Medicare, to describe both sides. It's crazy. And we even use this same alphabet system to delineate between the two. It is so confusing. Hopefully this groundwork helps you make a great decision. So, traditional Medicare or Medicare Advantage. Traditional Medicare sounds like traditional Medicare, and that is you get Part A, which is typically at no additional cost. You've been paying for it along the way. Okay, Part A is your hospital care. All right. So traditional Medicare, Part A, then you add Part B, which is your doctor visits, and that does come at a cost, Right now in 2020, that cost is about $144.60 per month, but that's the base cost. That cost can go up depending on your income, your adjusted gross income from 2 years ago, prior year. Okay, so that base cost right now is $144.60 per individual that's on Medicare, but then that could go up if your income is too high. Now, what does income mean too high? Well, if you withdraw a lot out of your IRA, pensions, that sort of stuff, that could make your income too high. The other thing is Social Security, and maybe you decided, well, I wanted to buy a new house and we're going to take 50 grand out of our IRA. All of that plays a role into what your income is, and that can influence what your Medicare payment is. They call that IRMA, where your income causes you to pay an extra amount on your Medicare Part B premium. So we're going to do another video about that, where just because there's tons of planning implications with this. So Part A. In traditional Medicare, you got Part A, typically your hospital your hospital coverage at no additional cost. Part B is your doctor visits. That's at an extra cost, about $144.60 per person per month. So A, B, D, okay, Part D is the only letter that makes sense, and that is D for drug. That's your drug coverage, that's your prescription drug coverage. You do have choices. There are different plans that you get to choose from within Part D. The cost varies from $10 a month to $30-some a month. I usually tell people just a ballpark budget, $25 a month, okay, for your Part D. That's your drug coverage, okay? So A, B, D, and a supplement. And supplements also come in plans, and like I said before, those plans are distinguished with letters, plan A through whatever, right? And so you're going to sit down with a Medicare expert. We've got a handful of them on our team, and you're going to talk about, okay, Is traditional Medicare or Medicare Advantage the best route for you? If it's traditional Medicare, A is this, B is this, D, here are your plans. What drugs are you taking? Are those generic or whatever? Now, formulary, non-formulary, all that sort of stuff. And then what sort of supplement is appropriate? How much deductible coverage do you want? How much out of pocket do you want? Okay, plan N or plan F, plan G, whatever. And then here's the cost for that. Typically, your supplement costs they're going to start around $160. They can go up each year with inflation or whatever, but they're going to start around $160, $175. So traditional Medicare is extremely comprehensive. I've heard people say this is pretty much the best health insurance you're ever going to get in your life. Okay, well that's good, because at that age 65 plus, you need great health insurance. So Part A, B, D, and a supplement. When you add all those costs together, I don't know, $350 a month, maybe $400 a month, somewhere in there, all right? That's what you're looking for traditional Medicare. You've got choices as far as plans within your prescription drug, Part D, and you've got choices in your Medicare supplements that also influences the cost as well. And then the big planning is obviously the decision, but then it's all the tax planning along the way, every single year in retirement, because you want to make sure that you're not paying extra for your Part B or your Part D, okay? Because your income went too high, because you sold a building, because you drew too much out of your IRA, because you did a big Roth conversion, something like that. That's traditional Medicare. Or you can go Medicare Advantage, okay? Medicare Advantage, you actually opt out of Medicare and you enroll in Medicare Part C. Medicare Part C. That was that letter that was missing in this traditional Medicare. So Medicare Part C, you actually pay the Part B premium, which is, again, $144.60 for most people based on your income level, okay? But then you sign up for actually, and I could get in trouble for saying this, but it's like privatized Medicare insurance through Anthem or through Humana or through United Healthcare. You actually go with a private company that has all the normal deductibles and out-of-pockets and blah, 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 all the nickel and dime stuff, and you go with a Medicare Advantage plan. So Part C is Medicare Advantage, and you pick a plan from these various providers, Anthem, United Health, right? So those types of companies vary in cost. You can actually find some plans where there is zero additional out-of-pocket cost. So you're only paying the $144.60 of Part B. So you'll have to sit down with a health insurance expert, a senior products expert, and look at what the choices are here and then what the costs are here to help you make the very best decision. That's your crash course. Lots of tax planning, lots of risk management, lots of cash flow decisions there. Because, as I said over here, traditional Medicare could be $350, $400 per person a month. Now that's a lot on a fixed income, right? But it pretty much covers, there's a small deductible, there's a little bit of out of pocket, but there's not much. Over here with Medicare Advantage, you're going to have a deductible, you're going to have out-of-pockets, you're going to have copays, that sort of stuff. And so it's a lower monthly amount in your budget, but there's more ongoing cost as you use it. So, which one is best for you? That's where the financial wisdom comes in. Your certified financial planner needs to understand Medicare enough so that they can look at your overall financial situation and say, yeah, you know what, here's how it works. I'm leaning towards this direction. We've already got that built in your retirement plan and it works. Or, gosh, we've built it into your retirement plan and your income sources and your health history. I'd probably go this direction. They should have a view, a perspective of your financial life and be able to give you some initial guidance and some initial teaching so that when you sit down with a Medicare expert, you're equipped to make a great decision. Ideally, as we have here at Korhorn Financial Group, those Medicare experts are on our team and they can collaborate with your CFP to make sure you're getting the very, very best service. Why? Because this open enrollment time period, you don't get to flip-flop that change. You don't get to say, well, I chose one, now I want the other. There's certain circumstances where you can, and you've got to prove that you're healthy enough or your plan went away, and then you can make a switch, okay? But otherwise, Medicare Open Enrollment right now, you get to choose a different Medicare Advantage plan if you'd like one. If instead of, well, I picked this certain Advantage plan, now I want this one. Okay, that's fine, that's fair game. Or you can change your prescription drug coverage. A Part D plan, you can switch your Part D. That's what open enrollment's all about. Our Medicare experts are sitting down with almost all of our Medicare clients because your prescriptions may have changed, your situation may have changed, your health may have changed, and it's important to review to make sure you've got the right stuff. So work with your certified financial planner and make sure you're equipped to make a great decision. And if you're already on Medicare, set up a time with your CFP and your Medicare expert to make sure you update and make any relevant changes as necessary. If you don't have a CFP or you're looking for a Medicare expert, contact our team at Korhorn Financial Group. Find us online, korhorn.com. That's Korhorn with a K. You can also find us wisemoneyshow.com. You'll find us there as well. Or just send us an email, info@korhorn.com. All right, there you have it. Go out and take your next wise step in your financial life.